Hello and welcome to Gluten Free and Gluttonous. I'm your host, Julie Young, and together we're going to explore the world of celiac disease and the gluten-free diet. Join me each episode as we talk to a different expert to explore the critical ins and outs of celiac disease and what it means to eat gluten-free and celiac safe. Let's see what we're eating today. I'm in Chicago, Illinois, and I'm so excited that today we're going to be getting takeout from one of my favorite restaurants, Wheat's End Cafe. I'll be enjoying my delicious meal from Wheat's End while virtually meeting with GI psychologist Dr. Alyse Bedell. Dr. Bedell is also an assistant professor of psychiatry and behavioral neuroscience at the University of Chicago. All right, now that we have our food, we're going to go talk to Dr. Alyse Bedell, GI psychologist. Welcome to Gluten Free and Gluttonous. I am your host, Julie Young, and I am here today with Dr. Alyse Bedell, who is a GI psychologist. So I want to start off just talking about, who you are, what's your background, and what's your relationship with celiac disease and other, GI diagnoses.
Yeah, so as you said, I'm a GI psychologist. So for those that might not know what exactly that means, it means that I'm a clinical psychologist. So I went to graduate school for clinical psychology. I have a PhD. Some folks have a PsyD, 2 doctoral degrees. And so that, includes all of that education and training around more general mental health conditions, but health psychology is a specialty within that. And GI psychology, or psychogastroenterology as it's sometimes called, is a subspecialty within that. So it's really working on psychosocial issues that are related to GI concerns. So celiac would be one of those disorders that I work with people to help manage. But in my case, I work with people with a range of GI diagnoses. So really anything is fair game if it's along the gastrointestinal tract. When I'm working with people with celiac disease, it's not going to be so much on the medical management and even really the dietary management. It's more on adjusting to, from a more psychological, emotional, or social perspective, on how to implement these changes and how to make these changes things that can be sustainable lifelong.
So in terms of how big of an impact celiac disease has on, like you said, the psychosocial aspect of someone's life compared to things maybe like, Crohn's or colitis or IBS, some of the more well-known, I would say, GI issues, are they pretty similar? Or I've heard some people think that, celiac is actually much more intensive just because of the nature of gluten and how it's sort of all-encompassing versus, say someone can't tolerate peppers. It's a lot easier to be like, oh, no peppers than no gluten.
Yes. I think, it depends a lot on a person's relationship to food and kind of the personal attachment that they have to food in their life. I would say the majority of people that I work with do really value food. It's part of their identity. It's part of their culture. It's part of how they relate to their families. And so I would say for the majority of people, especially the folks that are getting referred to me with celiac disease, I would say that it is a pretty impactful experience having to change their diet in that way. And you're right, it's not just excluding 1 or 2 or 3 or even 5 types of food. It's excluding a major ingredient in many, many, many of the foods that we eat.
I know for me, sometimes the biggest thing is just I'm tired of thinking about what I'm putting into my body. I just want to grab something and turn my brain off and just not even consider it.
I think that, beyond me necessarily trying to come in and problem solve with the patient on really how to change anything, I actually think with celiac disease, it's one of these conditions where sometimes my role is just to give someone permission to feel sad. And I think oftentimes, especially I would say because celiac doesn't necessarily have the same connotation of dangerousness as some of the other conditions that you've mentioned, like Crohn's disease, for example. I think sometimes folks may feel like they don't have as much permission to really just grieve the loss of their health that they had before, right? Their ability to just eat things without worry, without, like you said, having to have many points of every day occupied by thinking about what they're eating, especially when they're early on in the process and are trying to establish their new kitchen, their new routines related to food. And so I think sometimes, my job is just help validate those concerns, give them permission to grieve, without actually trying to jump in and change anything.
Why is it important to seek out, I think, any mental health professional can always be helpful to some extent, but when you have these diagnoses, seeking out a GI psychologist, or at least, bringing your GI doctor into the fold to really properly address it and make sure that you're not crossing the lines between, anxiety and depression and whatever other diagnoses with the actual, physical celiac diagnosis.
Yeah, it's such a good point. You may not need to work with a GI psychologist for months and months, or certainly, not years or years. It may only need to be a handful of sessions to really focus on the more celiac disease or GI related issues. And I do think if someone has access to working with a GI psychologist, that someone that actually has some education and some understanding of celiac disease, that person is going to be particularly well suited to help the person that they're meeting with differentiate between more general mental health concerns requiring a different type of treatment, or the more GI specific or celiac specific issues, which really would be more appropriate for that type of a treatment setting.
This is Gluten Free and Gluttonous, and so part of this whole series is going to be sharing, some of the places that I have discovered or that people have recommended to me that are celiac safe, gluten free, and reminding people, like we said, you can still enjoy food, you can still try new things, you can still have all your old favorite foods even though you're gluten free. And we are so lucky here in Chicago to have a lot of options, and in particular we have Wheat's End, which is in the Lakeview neighborhood of Chicago. It's entirely dedicated gluten free. When I found it, I cried tears of joy because there is something so wonderful about being able to order anything off a menu. I had some takeout sent to you. I picked up some as well for me. I'm just gonna show, I already took a few bites because I couldn't resist, but I got their pancakes. I always get one blueberry and one chocolate chip because they're so good. I want a little bit of both. What did you order, Dr. Bedell?
I ordered a cranberry and turkey panini, which I will show you. I have not eaten yet, and I'm very excited to eat soon.
Yes. Oh, that looks so good. It's like the perfect, commercial, halfway cut. Ooh, yes. And the fries. They have sweet potato fries. They have regular fries. This is great. I'm so excited. I'm not going to make you eat your whole meal on camera. But thank you so much for joining me.
Thanks so much for having me, Julie.